Hello, my name is Kay Aubrey-Chimene, and I am the director of Photonic Therapy Institute, your host for this Independence from Pain Summit. My guest this session is Marcy Denton of MMD Wellness Group in Kerrville, Texas. Marcy is a bit of a Renaissance woman. She's a scientist, a seasoned educator, having taught in classrooms and boardrooms for over 40 years. She's also a serial entrepreneur. Currently the founder and owner of MMD Wellness Groups, she supports light therapy, emotional resolution, spiritual growth, and many other educational endeavors. Marcy and I have worked together in the past decade developing light therapy educational programs, and I've come to realize that she is a vast repository of insights and knowledge. Her topic today is the power of nitric oxide and its relationship to pain. Welcome, Marcy.
Well, thank you. It's an honor and a pleasure to be here this afternoon. For those of you who have a question about nitric oxide, you probably don't have a question about pain. Most of us know about pain, and we know people who have pain. So this is very, very timely and very important. We're talking about nitric oxide and pain, so let's do a little bit of a review of what nitric oxide is, which is not the laughing gas. That's nitrous oxide. This is a molecule that has been researched dramatically over the last few years, but it all started way back in the 1995, 93, 95, and then it was awarded to 3 scientists for the fact that they discovered it in 1997. Or 98, actually, I guess I'm time's off. But the wonderful thing about this is that it brought it to the forefront, and it said its nickname, they gave it a nickname of the miracle molecule. Why? Well, because it does so many wonderful things, and we're really standing on the shoulders of so many people who've done research on pieces of health and wellness that we are kind of gathering together when we talk about photobiomodulation and nitric oxide. So let's see what we're going to be talking about. We'll talk about the benefits of nitric oxide. We're going to be talking about how nitric oxide changes, in some events, it changes how we know about pain, how we feel it, how we sense it. And then what's about this in the future? What are we doing with it in the future? So those are the topics for today. There are 3 kinds of nitric oxide based on sort of where they're developed, where they're produced. The endothelium is a lining of the circulatory system, and we'll show you a little bit about that in a second, but they named it eNOS, and then iNOS, inducible nitric oxide, is sometimes called mitochondrial nitric oxide. So I guess that you can figure out that this nitric oxide is produced by the mitochondria. And then there's nitric oxide produced in the brain and with nerves, and that would be BNOS and NNOS. Why does that make a difference? We'll see in just a little bit. All of them, all of these molecules are simply one nitrogen and one oxygen. The name is given where it's developed and in a sense what its job is. So what do we know? Well, nitric oxide is extremely important as a messenger molecule. How does the DNA that you get from your mom and dad, how does it work? Well, who tells it what to do? Who's its boss? Signaling molecules are the bosses of the DNA. And they tell it, okay, do this, do that. Well, when we look at what nitric oxide does, it has a tremendous effect on the cardiovascular system. It has a tremendous effect on the nervous system. And we're beginning to understand now the effect on the immune system. It's been mentioned immune, but not in the detail that we need it today because of our situation of the virus that is, doing some running amok us, as it were. So when it's released, it goes into a very, very important activity, which is called vasodilation. That means the blood vessels widen. What does that do? Well, it allows blood to go faster. It allows blood to get where it needs to go, which is, by the way, carrying oxygen, which is part of in health and wellness that we really want to go well. But it also reduces inflammation, and we'll talk about that in detail as well. So just to sort of tell you that there's a lot going on with nitric oxide, this picture seems to be so valuable. I mean, you can just look. I said cardiovascular first. Yes, that's basically what kind of started off the scenario of, nitric oxide being the miracle molecule. But the nervous system, the respiratory tract, the central nervous system, making cells, new cells, and killing the dead, the ones that need to be dead. I mean, it's a very interesting process of keeping you safe and healthy is you get rid of the cells that are old. Gastrointestinal, immunology, and your sexual health. As we know, the nitric oxide discovery led to vasodilation and Viagra. It's just one of the many things that are extremely important for health and wellness. So, how do you get it? Well, diet is huge. Exercise is important, and sleep is important. But let's go to diet. Let's look at diet, because that's one of those key things that most people don't know, is that it requires L-arginine, which is an amino acid that you get from food. And what happens is that actually, the enzyme for nitric oxide synthase converts the L-arginine into this gas, volatile gas, doesn't last long. So how do you get this L-arginine in your diet? Turkey, pork, chicken, pumpkin seeds, soybeans, peanut. I mean, we can go on and on, but the key piece is that it's not just once a week do you eat these things. Do you need nitric oxide to open up your vascular system every day? Then you probably should have a little bit of support from your diet every day. Now, exercise and sleep, yes, very important. And one of the key things about this is that this is a health and wellness approach that we're taking, that this isn't just about pain, it's about your whole wellness system. So keep this in mind as we go through and get more specific about pain. We all want to be under the umbrella of health and wellness with nitric oxide. So here's that picture I was explaining a little bit ago, and I want to point out something really important, and that is that this yellow lining is called endothelium tissue. It's a one layer thick, and that's what releases the nitric oxide. And look at the dilation, how much larger this vessel is than this one. The older we get, the less nitric oxide we make and the less vasodilation we have. But there's a way to add more, and that's a diet, but there's also light. But look at this, this is fascinating. When we age, so, we look at percent of narrowing. So we get 100% of nitric oxide we can ever make when we're in our 20s. But we only, in our 60s, make 15%. Why? Well, that's part of aging. And that leads to lack of vasodilation. So if you can increase the amount of nitric oxide that you're producing, wouldn't you think that's a good idea? So this whole concept of aging has everything to do with a reduction in all signaling molecules are reduced, but nitric oxide in particular. So just when we think about that, we think, oh, well, I'm just getting old. I'm just as good as I used to be. Well, you could be, but most of us age because we have lack of the signaling molecules that tell the DNA. The DNA doesn't change. DNA still can do whatever it needs to do. It just has to be told what to do. And that's what the signaling molecules do. So, so let me get rid of this for a second. I'll put it over here. Okay. And here we go. So as I was saying, the systemic health and wellness is really very key. And the reduction in pain, we're talking about a black hat and a white hat. Now, that's just to illustrate that there's some things going on with nitric oxide that do cause inflammation and pain, which is the first line of defense. So it's not all bad, but I call it a black hat. So just bear in mind, it's not a bad black hat. It's just that there is inflammation and pain develop when, well, here's the deal. If you're injured, if you have some type of dysfunction within your systems, and when you get older, just in general, you get older, there's this black hat event. So let's look and see what that says. So the black hat, it has to do with the mitochondrial nitric oxide. So remember that the three kinds, well, this one is produced by the mitochondria, and it has this effect on using oxygen, which means that it ends up blocking the use of oxygen. So what does that look like in the real world? It just simply means that if there's an injury, if there's a disease, or you're just older, there is a need for the immune response to kick in, which is inflammation. Now, we've all heard that inflammation is not good. Lots of money being spent on anti-inflammatory medications. Well, that's true. But the real reason we have inflammation and pain is to say, we've got an issue here we need to deal with. And then it calls in the rest of the body systems, the macrophages, the white blood cells, and all that. So it's a real important part of health and wellness. It just is uncomfortable. But that's the black hat. So this essential role that it has, you don't want it to go on for a long time. That's where we get into the let's do something about the pain. Let's do something about it. So how do we deal with this nervous system? How many of you remember the central nervous system, peripheral nervous system? Well, this is an Atom video that is really a wonderful short representation of the nervous system. And if we're going to talk about pain, we have to talk a little bit about the review of this.
The nervous system is made up of two parts. Each part contains billions of neurons. The first part is the central nervous system. It contains the brain and spinal cord, which is a fibrous, rope-like structure that runs through the spinal column down the middle of the back. The other part is the peripheral nervous system. It consists of thousands of nerves that connect the spinal cord to muscles and sensory receptors. The peripheral nervous system is responsible for reflexes, which help the body avoid serious injury. It's also responsible for the fight or flight response that helps protect you when you feel stress or danger. Let's examine an individual neuron up close. Here is a peripheral nerve. Each one of the nerve bundles, or fascicles, contains hundreds of individual nerve fibers. Here's an individual neuron with its dendrites, axon, and cell body. The dendrites are tree-like structures. Their job is to receive signals from other neurons and from special sensory cells that tell us about our surroundings. The cell body is the headquarters of the neuron. It contains the cell's DNA. The axon transmits signals away from the cell body to other neurons. Many neurons are insulated like pieces of electrical wire. The insulation protects them and allows their signals to move faster along the axon. Without it, signals from the brain might never reach muscle groups in the limbs. Motor neurons are responsible for voluntary control of the muscles all over the body. The operation of the nervous system depends on how well neurons communicate. For an electrical signal to travel between two neurons, it must first be converted to a chemical signal. Then it crosses a space about a millionth of an inch wide. The space is called a synapse. The chemical signal is called a neurotransmitter. Neurotransmitters allow the billions of neurons in the nervous system to communicate with one another. That's what makes the nervous system the body's master communicator.
Well, now that you've seen your peripheral system, you now are aware that they pick up information. And there are neurons that pick up smell and taste and pressure, but there are some that pick up pain. And we've put pain into categories, acute and chronic, and we've named the nerves nociceptive, visceral, and neuropathic. And you don't have to memorize this today, but we're going to talk about all of them so they'll make more sense in just a little bit. So pain goes from a source, a trigger, where the nerve is stimulated, to the brain. And this transmission has to go through the spinal cord. And I've got a picture in just a second. Sometimes that pain is changed. It's lessened. It's inhibited. And sometimes it's enhanced. Sometimes it gets worse. So that leads us to perception. So it is so fascinating, but a little complicated. But let's go for a little bit about modulation. When we look at nitric oxide, we just now said nitric oxide wearing a black hat causes inflammation and pain. Okay? That's a good thing, sort of. We want it to do that, but we don't want it to stay forever. And sometimes this pain, this fast pain, this pain that happens right away, stays around, and the nerve that's supposed to be a touch nerve where you just feel something and you can tell that it's cold or hot or it's just there, a texture, becomes hijacked. And instead of it sending a message to the brain that says, oh, this is rough, or this is cold, or this is hot, it says, ouch. That's called sensitization. And I have trouble saying it, but it means that it's sensitized. That's just not fair, but that happens. So how do you get rid of it? Well, we're going to use light. And this is now beginning to talk about how do you deal with this pain that's been caused by a trigger on a nerve. And the first thing is that you want yourself to be relaxed or in a peaceful state. That's called parasympathetic. And one way to do that is put light on the vagus nerve, which is right in here, comes down like this. And it's the primary relaxation response by putting light there. There are other locations, and Diana Connolly is going to be speaking to this in this,
Getting your best results session.
Yes, the best results session of how to use light to mitigate pain. And this is one of the things she's going to be talking about. How do you get people and yourself into a parasympathetic state? But once you're there, then you want to put light where it hurts. But now we're going to talk about something even odd for some people, is you also want to put it on the spinal cord where that nerve enters the spinal cord. Not just anywhere, but specifically where the nerve travels to the spinal cord. I bet you didn't know that there's actually a dermatome that tells you. So we're going to show you that picture too. And some of you do know. So it's just a reminder that this is a key piece to dealing with the acute pain. So when it hurts, you put light on it, and Dinah will go into this a little bit more, but you really, kind of give it 4 hours. You put ice, you put light. but you don't let that pain get to the point where it was before. If you started out with, you know, on a scale of 1 to 10 and it was 20, you don't let that pain get up you know, when it starts heading back up, apply light, apply ice. And so the key is not to have to start over. That nerve sensation, the nerve information, the nerve can get, you know, the pain can cause it to just go a little bit faster than you would like. That's acute pain. So when you deal with it fast and you don't let it get ahead of you, you have much better results. But chronic pain is way different. So if you have pain over a certain, I think it's a 3-month period. Of course, it's some, I've seen it 6 months, but 3 months generally, you put light, the same thing, find a location, usually the vagus nerve, to relax your client or yourself. Where does it hurt? Put it there. Where did it enter the spinal cord? Put it there. But for chronic pain, we have to show where it is on the forehead. And this particular video that we're going to show has 2 things going on. It's going to talk about acute pain at the beginning and how the message goes up and goes down and etc. But when it becomes chronic, they're going to show you how specifically that affects the emotional piece to this. So now we get to the part of interaction of photobiomodulation and nitric oxide. And the research started way back. And this is a Michael Hamlin article. Michael Hamlin has been teaching and researching, it seems, forever, but this article was presented in 2008. I didn't know light therapy existed in 2008. And here is his article that shows nitric oxide's relationship to low-level light therapy. That's what it was called in 2008. So I just wanted to show this to you, that we're standing on the shoulders of brilliant, wonderful researchers and people who've been looking at this as an intervention for quality of life for a long time. Also, I wanted to bring up this because sometimes we talk about the mitochondria and we forget that it's a weird looking dude here. This is a symbiotic organelle, they call it. It used to be its own independent organism. It has its own DNA. It is derived from your mother. It's called maternal DNA. It's really a cool system. And it's responsible for us having the use of our food. If we didn't have mitochondria, what good would it be to have food? It wouldn't do any good for us. So this organelle for muscles and tendon, you know, we start looking at where do you have the most mitochondria. It's the muscle tissue, for example, that has to use a lot of energy. So the mitochondria, and if you'll notice that you've got well, just for grins, let's just look at this real quick. There's an outer layer and there's this inner layer. And what's fascinating about this is that this is really key to understanding how nitric oxide works. And so let's just see what we've got here. Okay. It uses the oxygen to make something called adenosine triphosphate, or ATP, unless it's blocked, which we've already talked about. So given that we can stop it from using oxygen and causing inflammation, which causes pain, it seems like this is a pretty important topic. So how do we get that? How do we undo that? You know, what do? Do you hope for that to happen? No, you apply light. This is so wonderful. It's so simple. We need two kinds of light. We need red and infrared. Now, we've had questions often, can I just put Christmas lights? And I say no. They have done the research that red has many different frequencies, and they have found a certain number of frequencies that work. Some frequencies don't. Christmas tree lights don't. I wish they did, but they don't. And infrared, this is beyond the visual spectrum. So what is it that makes it so important is that we can have devices, all kinds of devices that provide these wavelengths, and the wavelength itself disassociates, gets rid of the nitric oxide that has been blocking. This is the mitochondrial, that we've labeled the black hat guy. Well, it sends it off into the circulatory system. It's a very volatile gas. It doesn't take long to be gone. But given that we have hemoglobin and capillaries around most cells of the body, it can be captured by the hemoglobin. Now, I don't have a slide, but there is one that I'm thinking of that says that, I'm going to go back to that in just a second. But what it says is that the circulatory system and the respiratory system are a three-gas system now. They now understand that oxygen's carried by the hemoglobin, red blood cell. Carbon dioxide's carried by the hemoglobin out to the, through the lungs, blah, 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 there it goes. But the nitric oxide released by this activity of light in a local area, it's captured and flows with the flow of the blood and gets to locations far from the site of the application of light. So you wonder, well, how come my knee hurts and my foot hurts and I put light on my knee and my foot gets better? It's because of the systemic effect of nitric oxide and the bloodstream. So this is a diagram. It is a long time being used by myself. It was produced by Winston Crump. And the key thing here is that what we're looking at here is the oxygen going into, in that acute cytochrome C. So that's our Pac-Man eating up the oxygen. It fits, look at this, physically oxygen goes into this enzyme, and then it takes in the oxygen. So this is oxygen, then it burns up the food and you get the ATP. But if you are older, if you have an injury or a disease, then the mitochondria makes nitric oxide. I would like to point out organic chemistry here, that nitric oxide is the same shape as oxygen. And it fits into this, it's no magic, it just fits, and therefore it blocks. So the injury causes excessive more nitric oxide than usual. It blocks. The oxygen can't get in. You shine light, and the nitric oxide's released. How cool is that? I think that's pretty cool. And people who you talk to can understand that, because it's a simple process. Why does light relieve pain is intertwined with nitric oxide doing what it's supposed to do if we have an injury. So we need the white blood cells to take care of the injury, but not for a very long time. We just need it to do its job and be done. But to get rid of it and to unblock this enzyme, we need light to help that process out. So there we go. So therefore, this is a repeat. The mitochondria uses the oxygen to make energy, ATP, unless it's blocked. And so these stressed cells go through 6 stages to get to the release of and the decrease in pain. Energy is absorbed by that enzyme, the Pac-Man. The nitric oxide, the mitochondrial nitric oxide, is released into the bloodstream. Whoops, I'm talking with my hands. ATP is therefore increased, oxidative stress is reduced, inflammation is reduced, pain decreases. And that's how the simple story goes. And I would like to just say that if you ever have somebody say, well, what does it do for me? It's very simple. It releases what's blocking the use of oxygen, and it lets the cell use oxygen, and that reduces the pain, and we have the energy to do work. Very simple, very complex, but it really is an awesome experience. So pain's normal. And this pain, which is protective, you can have, you can stump your toe, you can hit your finger with a hammer, and there's definite injury to it. There's definite, this whole concept that you're blocking, that's going to happen. If you have this pain for over 3 months, they label it chronic pain. And there's an emotional piece that happens with this. So we want to go into a little more detail. How many of you have ever had the knife in the butt? This is what I call the sciatica issue. Isn't this just an incredible representation of the pain that sometimes you get when the back pinches that nerve and it goes, I'm not having any of this, I'm letting you know. So that injury sets up this blockage of the cytochrome C. And that's where you get the inflammation increasing, which causes the effect on the nociceptive nerves, and boom, you got the pain showing up. So this short-term acute pain, you can heal it. Your body heals it within 3 months, then we're good. If not, then they name it acute. They name the acute pain chronic. All right, so how is it that it moves to the prefrontal cortex? That is very interesting, and something that when I talk prefrontal cortex, we're going, where is that? Well, here it is. So this right here is the prefrontal cortex, and right in here, that's not the normal place that you feel pain. Normally, the acute pain is in the thymus, which is right in here behind this temporal lobe. And it's projected basically on the sensory cortex. Where in your body do you feel it is, right in here. And how the muscles react comes out of here. But what happens in the 3 months is that the pain begins to be perceived in the area of anticipation, anxiety, some depression, fear, basically afraid that you're going to hurt, because you do hurt. So don't move like this. Don't sleep in the bed. You got to sleep in the chair. I mean, all kinds of emotional pieces to this. So let's watch that video and let's see what it tells us.
Pain perception and the human brain. Part of the survival value of pain is its association with learning centers in the brain. The brain circuitry associated with nociceptive and neuropathic pain involves areas considered to be essential in emotional learning, memory, and reward. The insula and anterior cingulate, together with the thalamus and basal ganglion, are most consistently activated in acute pain. The brainstem and the descending pain modulatory system also play a role, where activity is observed in both the anticipation and perception of pain. Clinical chronic pain causes increased activation of prefrontal cortical regions, which implies that chronic pain distorts the cognitive and emotional perception and processing of everyday experiences. Hypervigilance and an impaired ability to extinguish aversive associations of fearful or painful events seems to involve interaction among medial prefrontal cortex, basal ganglion, and amygdala, which is consistent with clinical data indicating that chronic pain patients usually suffer from elevated anxiety, depression, and decreased quality of life. These observations demonstrate that the brain in healthy subjects is distinct from those with chronic pain, indicating that chronic pain is at least partly a neurodegenerative disease.
Nociceptive have not been able to figure out a cheat on this one, but it means the pain that comes from hitting your thumb with a hammer. It means that this is the pain of twisting your ankle. Comes from the body. It's not anything other than you can remember that, oh my gosh, you tripped, you fell, you hit your knee, you hit your hand, you twisted your, everything hurts, but you know when it happened. But when it's coming from your nerves, when it's coming from a degenerative event, like the chronic pain has become, then we call it a neuropathic. Pathic meaning illness, neuro meaning nerve. And it can be from a sensitized nerve that used to be a touch nerve and now it's a pain nerve, or it can actually be dysfunctional and damage to nerves, for example, in multiple sclerosis, where the myelin is actually dissolving. So this pain, this neuropathic pain, means that it's not simple. It's not put the light where it hurts. You've got to deal with the perception of it. And that's why we wanted to talk about the prefrontal cortex. But in addition, I wanted to show you, because it's been such a long time and you've had your science class, or maybe it hasn't, but look at all these nerve endings. This is a touch receptor. This is another kind of touch receptor. And then here's another kind of touch receptor. What does that mean? It means a very interesting way to tell the difference between what you're touching. Is it rough? Is it cold? Is it hot? Oh, we've got cold over here too. How much pressure does it take to stimulate this one? Look how deep it is. What about this one? Oh, what about this one? You see how these right here, not only are they here, they're way close to the surface. And these are those pain, heat, and cold neurons. So when we talk about the differences that we see in how we know something is going on in the world, we say that the nervous system tells us what's going on. How do we know? Our nerve endings, and these would be stimulated. They would be the nociceptive nerves. And all right, now we get into some teaching, as we say. So if you have your skin, and we've just seen this nerve, the pain nerve, be very close to the surface, you stump your toe, you hit your thumb, whatever, it sends the message to the spinal cord, and it jumps between one kind of nerve to another kind of nerve called the efferent nerve, and this is the afferent. I call A the first one and E the second one. So the first nerve takes the message into the spine and the other to the muscle. Have you ever hit your toe and before you knew it, before you even felt the pain, you had your foot off of and hopping around. You didn't have to think about it. This is that reflex. This is that reflex. Now, when we say put the light where the nerve enters the spinal cord, well, let's just talk about that toe. So if the toe is, you know, way down at the bottom, I mean, where does it go? So you stump your toe. Well, here's your diagram of nerves that go into, look at this, right in here. Now, that's not to say that if you hit the inside of your foot, where does that nerve go? It goes much lower. So knowing where the nerve enters the spinal cord is critical. And the same for your arm. Look at where if you have your hammer and you miss and you hit your finger, okay, that's moving up, okay, and it moves like this and it goes way high up in here, your cervical. But what if it's your inside arm? You scrape it, you fall, or you grab it onto something and you're hurting here. Where does that go? It goes a little bit lower into your thoracic. Knowing where the nerve that is injured enters the spine means that you can address something very important about nitric oxide. So this is a better picture showing you, here's your finger, here it goes into the spinal cord. There is an inner neuron that literally connects to the brain, does the messaging between the two nerves. And this goes up to the brain, and this is where it might become, if it's not what you just did, which hit your finger, what if it's just touch and this finger has been messed up for months? And it doesn't matter if you touch gently or you touch hard, it hurts. It shouldn't be hurting, it's just touch. Well, this is the nerve that causes the problem. How do you stop this information? How does light help you stop this information? That's what we're going to talk about, and it does. So the nice thing is that it actually does make a difference in how you perceive it. So this is another example of the inner neuron, and that becomes hot, becomes doing something hijacked. It shouldn't be, but it is. And I love this picture. It's kind of like says, okay, I'm thinking about it. Now what? Well, okay, thinking about pain doesn't always get you there. So let's do, at this point, let's play that video. And the shift goes to the prefrontal cortex. This research is a 2013 article. And it's sort of been the subtlety of our business that some of us just thought maybe we were doing the right thing and the person was just, resistant to getting better, because sometimes it wasn't getting better fast enough for her or your client or for you. And this is why, because we weren't addressing the location in the brain, which is the front of the forehead. So this is the review. So we're looking at chronic pain, location, location, location. So when you say where it hurts, you want to start with the parasympathetic. You want to go where it joins the spinal cord. You want to go where it's perceived in the brain. And we want to say for sure that this is the vagus nerve. Very critical. Where it hurts on the body, very key. Where it joins the spinal cord, very key. And the prefrontal cortex, where it is eventually perceived by the brain. This is probably my favorite picture. And the reason is because in all of my research, I have not found that the nitric oxide story, the information that it works like a painkiller, like opiates, I couldn't, you know, they would say it, but then I wanted to know how it would work. And I finally found this particular picture, and this goes into the modulation. And just because we're talking about photobiomodulation and pain, I want to really emphasize this. So you stump your toe, and lo and behold, there it goes. The pain comes in, and here it comes. Okay, and it goes up to the brain, and it comes back down. What happens in here can make a difference in your perception. And what can you do here that makes the perception different than if you didn't have these things going on? What if it was just the cycle? So this is why this is very key. This is where, believe it or not, the opioids have a receptor site. And the alpha-2 agonist and the NMDA. I mean, we've got research on pain that's detailed, and it just goes on, and hidden in this list is NO inhibitors. Nitric oxide inhibits like the opioids. You put light on the spinal cord where the nerve is being hijacked, or maybe just simply it's that much pain, and instead of using a drug, you put light, and nitric oxide blocks the receptor site. And that means the message is stopped. It doesn't go to the brain. It isn't perceived because it didn't get there. It's inhibited in its transmission. So when we say that nitric oxide's effect on pain, this whole story is about nitric oxide and how do you get it, and how does it work, and how do you use it to mitigate pain is pretty much in this picture. But it's all understanding how valuable nitric oxide is to health and wellness in general, and then specifically to pain. And let's just use it in a way that is, you know, effective. And exercise, make sure our diet, hey, if we don't have the L-arginine, it doesn't matter that we put light here. You know, we can only make so much, and we have to make it from the raw materials that we have in our body. So yes, it's important. So this one last slide, this showed up in my life May 18th. Isn't this crazy? It just more and more and more fascinating information. I didn't know what optogenetics meant, but optogenetics is using light to activate cells in the brain. How long have they been doing this? 20 years. Way before that first article in 2005, I guess. Think about that. Isn't that amazing? They've been using animals, but they've just begun using this kind of a concept on humans. So this amygdala that we had a picture of before, but the amygdala is a very key activated, it activates all kinds of emotional content, but also it's a very powerful part of the brain that's related to interactions and behaviors and so forth, but memories of pain. And that means that if we can turn off the chronic pain or the acute pain without opiates, without drugs, then the whole point of this research is so that we don't end up with hospitalized patients coming out addicted to drugs. Anyway, this is May 18th, 2020, and it's Science Daily, and we'll provide these articles for you. It's just really fun as we're talking about the value of light and pain for this to show up and say, yeah, they've been doing this putting it with fiber optics into mice's brains. They're not doing that to humans. So they're coming up with other ways of getting the light to the brain. But the negative is that when the light is turned off, pain comes back, or at least until it is mitigated by the change in the body. But wouldn't that be awesome if we can take this horrible, horrible pain that some people have with cancers and so forth, and we can put a light on the amygdala by way of, focused light, and turn that pain into management? Wouldn't that be awesome? Thank you so very much.
Yeah, that's a great reason for lighting up the brain even more, lighting up around the forehead, over the ears. That's how my understanding of lighting the amygdala is the very top of the head.
It's right in
the ears, right.
Yeah. So if you wrap the head in light, it's exciting to be part of this industry right now. So I'm just delighted to have a chance to share what I know, and my information is I've used it. It works. So anyway, Kay, anything else that you?
Well, I know that you've agreed to also do a section. You've got a bunch of new research coming in, and some that you're actually doing yourself on nitric oxide for the current pandemic with COVID-19. So we'll look forward to listening to that session as well.
Right. Well, thank you so very much again for including me into this this summit, and I look forward to hearing and listening to everyone who's on the ticket. It looks just phenomenal. So thank you, Kay, for doing this. This is wonderful.
Thank you, Marcy. We'll talk to you soon.
You bet.